Okay, well, hey guys, this is Dr. Sean over at Fortis, and this is the end. This is the end, my friend. This is the culmination, the time for palliative care, hospice of this class, the cul-de-sac, if you will, the culmination of everything that you've done so far. And I got to say, I'm proud of you. You guys have done really, really well. This is, of course, week 6 of terminology class, OAHP, what's it called? 105. And we're going to look at this thing here, if I can get it to open up. There we go. And we're just going to read through really quickly. If you can see my, there we go. There's my cursor, and we're going to go through this really, really quick. I'm going to look at this side over here, the marvel of creation. All right, this is the end of it. So week 6, all the stuff that needs to be done. Remember, everything needs to be done, turned in by Friday night, midnight or so, whatever it is, because the class is over. And unless you've already made a situation known to me, nothing is received after the end of class. So we don't do makeup work or anything like that. So get on it. You do have time. Burn the midnight oil. Grab some things, some snacks and things. And most of you are not worried about that. The vast majority of you are not. We're going to go through learning outcomes really quick for the week. And that's going to be applied terminology related to urology. That's anything to do with urine. So we're talking about the kidneys and the urinary bladder and the ureters and all that kind of jazz. And the structures and functions of the male reproductive system. The male reproductive system, remember, is the outdoor system, right? The indoor plumbing is the female system. Utilize medical terminology related to spermatogenesis. Spermato means that's the sperm cells, and genesis is to develop or to create. So how those are made in the testes and the epididymis and all of that jazz. Apply terminology related to obstetrics and gynecology. So obstetrics and gynecology is about having babies, right? Women have babies. And so it has to do with the uterus and the cervix and the vaginal canal and the ovaries and the fallopian tubes, or the uterine tubes, whatever you want to call them, and things like that. Utilize medical terminology related to pregnancy. So the different phases of pregnancy. Some of you have gone through that. And you remember not being able to lay face down, don't you? But here you are. Now their kids are running around terrorizing the house while you're trying to study. I know. We've been there. Development of the fetus and childbirth and the process of childbirth. Now, some of you are going to go on to become medical assistants or nurses or maybe even gynecologists or obstetricians or something like that, or nurse practitioners. Whatever it is you're going to do, you're going to be dealing with pregnancy at times. Even if you end up outside of that, and like I do, I deal with people that are pregnant in acupuncture and chiropractic. So we want to make sure that their spines are in alignment. And yes, we can adjust pregnant women. It's just a different technique. You don't go jumping up and down on them like it's WWE. It's all about technique and finesse, actually. And then they don't lay face down; they lay on their side or on the back. Utilize medical terminology. Apply correct medical terminology related to structure and functions of the breast tissue. So that's going to be the glands and the areola and all of that jazz, and why those are important. And oddly enough, we are one of the only mammals that actually maintain breast tissue even when not pregnant. Very weird, or when breastfeeding. Communicate accurately with the medical terminology related to obstetrics, gynecology, and the male reproductive system, written in verbal forms. Okay, very easy, right? You guys can do that. That's no problem. You've been doing that. I've seen what you guys have done for the discussion boards and stuff like that. I just want to do a quick 3 or 4 minute thing. We're coming up on 4 minutes. Let's go through here. I don't want to do that. Let's not do any textbook stuff. Creating life, it goes through. There we go. There's the male reproductive system. Read through that stuff. The questions are not as hard as you'd think. There we go. There's the traveling of the egg, and who knew that they're that big and they're blue? They're not. Actually, the smallest cell or individual part of a human body is the sperm cell. The largest is the egg. So the egg you can actually see with the naked eye if you have good eyes. I'd have to use my glasses, but you get the idea. The uterus and stuff like that sitting down inside the pelvis for the female. And then here we go. There's the sizes. That doesn't show us much. The actual sizes you can find online, but like from tiny to this big at the end. We've all gone through that, haven't we? Structure of the breast, the reproductive system knowledge, and then you have quizzes and things like that. So just sorry, wanted to give you guys a heads up. Don't forget, do the 2 discussion prompts. Those are really important. A lot of you missed points on that. I know you're running out of gas. Don't run out of gas. This is the midnight oil time, and I hope you guys are doing well. This is whatever day it is, doesn't matter, because I'm going to post this right in the middle of the week so that I can give you guys a little motivation to go. Let me know if there's any problems or any issues with this. I will be online quite a bit this week. I'll be checking things, looking at the discussions, looking at some of your other stuff, and seeing if there's anything missing. I'm gonna poke you for it. Now, some of it, if it's too late, don't forget to check the policy on late work. If it's too late, we can't accept it, but that's okay because you're going to be getting all the other stuff done. Week 5, week 4, those still can be turned in. Week 6 as well. So I hope you guys are doing well. Take care of yourselves, and we'll talk to you on the flip side. Bye.